Hello, my name is Angelica Buffaloe, and for my journal club number 2, I focused on a paper titled Natural Language Processing for Adjudication of Heart Failure in the Electronic Health Record. So, this paper discusses the process of training and validating a natural language processing model that can automatically identify heart failure hospitalizations from discharge summaries. Just a brief information on heart failure. The CDC defines heart failures as a condition where the heart cannot pump enough blood and oxygen to support other organs in your body. In 2023, there were over 450,000 death certificates that included heart failure, with 14.6 of them being the main cause of death. In 2024, 6.7 million adults above the age of 20 had heart failure in the United States. And with the image in the slide, it's titled Heart Failure Deaths 2018 to 2020 in adults 35 and up, based on each county. And as we can see, like the middle of the southern US, has the highest age adjusted prevalence when related to heart failure deaths. So yes, very high in the middle southern region. Heart failure could be caused by several things, such as smoking tobacco, eating foods high in fat, sodium, and cholesterol, not exercising, drinking an excessive amount of alcohol, pre-existing medical conditions such as coronary heart disease, diabetes, high blood pressure, heart valve disease. And some symptoms of heart failure can include trouble while breathing laying down, trouble breathing while lying down, weight gain paired with swelling in the stomach, legs, ankles, or feet, and having a shortness of breath while doing simple daily activities. So, what is being solved in this paper? The researchers want to use electronic health records, or EHR, to accelerate heart failure research. Unfortunately, using EHR data can be limited because the International Classification of Disease, or ICD, diagnosis codes that they used aren't always accurate. Developing an accurate NLP model can train complex EHR data that has few labeled examples. So, their main goal is to create a model that can sort through EHR records and find heart failure deaths, despite if it has enough labeled examples in them. What's the purpose of solving this problem? So, using EHR data can accelerate heart failure research. Results from this research can be used in epidemiology, biology, and policy making. So, finding the correlations to heart failure can help in preventative efforts. This problem is important because using a trained model can improve both the efficiency and reliability of research. Since heart failure is a growing epidemic in the United States, this provides an easier way to research. The research is crucial in improving patient outcomes and guiding healthcare decisions. So the methods used, um, the researchers use EHR data from hospitalizations in the community care cohort project. There was a cohort of over 520,000 patients, 61% of them being women, with a mean age of 48 years old. Patients received longitudinal primary care from 2001 to 2008 at Mass General Brigham in Massachusetts. Board certified cardiologists confirmed if the hospitalization records met the standardized data collection for cardiovascular trials initiative criteria for heart failure. So that includes one symptom, two signs, and one treatment. A training set of 1,268, a testing set of 214, and a validation set of 452 were created for this research. The researchers tested six existing transformer-based NLP models. These were trained on summary text with cardiologist labels and were compared on how well they performed on the test set. The model chosen was developed from clinical longformer. It performed better than the regular longformer and models with clinical pre-training and short attention windows. So, focusing on that more, the clinical longformer model had an average precision of 0.88, while the longformer model had an average precision of 0.79. The clinical pre-training models had an average precision of 0.79 also. In the validation set, 162 of the 452, or 36%, hospitalizations were confirmed by heart failure cardiologists. Adding the NLP model to ICD codes improved accuracy with an average precision of 0.88 and an AUROC of 0.93. The combined model had an 81% precision and 82% recall. Using ICD alone resulted in a 36% precision due to frequent mislabeled patients and a 100% recall. And everything that I just explained is in this image on the right. So it was found that the NLP model performed well on 211 patients in the validation set who had a heart failure ICD code. The AURC was 0.89. Hospitalizations without heart failure ICD codes only produce 1 out of 250 cases, which were confirmed by cardiologists. The NLP model also recognized this single case. The model was able to find hidden heart failure cases. Out of the 100,000 hospitalizations, 895 were flagged as possible heart failure cases, and then it was found that 45% of those were true. This results in less false positives when using this model. So that was all for the test set. When the NLP was applied to the community care cohort project, 21,611 patients had at least one heart failure ICD code, but only 9,690, or 45%, were confirmed. When the new cases were added to the community care cohort project, rates that were seen in other large community studies matched results when using an NLP model with ICD codes. Using ICD codes alone resulted in overestimated heart failure rates. With men over the age of 75, the true rate was 22.2 per 1,000 patients. With ICD codes alone, it was 38.5 per 1,000 patients. So overall, I liked the research paper. I feel like the information was detailed and straight to the point. It really wasn't a long paper. It was only about 2.5 pages. However, um, that being said, there were several limitations to the model, that the researchers mentioned that I also agreed with. So they said that it's not known if the NLP model can be used on other emergency health record systems. This would be a great model if it could be used universally. Yeah, and that's kind of what's hard about it. Like this can only be used um, at the Brigham in Massachusetts. So it would be nice if it was used universally. Also, it was mentioned that the model can only be used with ICD codes related to heart failure, resulting in missed cases that didn't have codes. The model only looks at inpatient discharge summaries. Using other notes could help find heart failure cases in outpatient and improve accuracy. And these are my references from the information about heart failure that I mentioned earlier. So overall, this research was, like I mentioned before, straight to the point, but I did like it. I do feel like it will be useful. As I said, heart failure is a rising epidemic in the United States, and so anything that will make the research easier is incredibly beneficial. And that is my presentation. If you have any questions, please let me know. Thank you.